Hello, I'm Dr. Ira Nash. Welcome to Well Said. Healthcare delivery can be deeply meaningful work. It can also be emotionally draining, overwhelming, and isolating. Healthcare professionals are asked to support others at their most vulnerable moments, often while pushing aside their own needs. But what if professional caregivers had someone dedicated to supporting them, helping them grow, cope, reflect, and thrive in their professional roles? Today we're exploring the world of professional caregiver coaching, what it is, why it matters, and how it's changing the lives of the people who care for all of us. To help us discuss this, we're joined by Dr. Phyllis Quinlan, a registered nurse with 40-plus years of experience in a variety of clinical, educational, and administrative roles. At Northwell, Dr. Quinlan is the internal coach for Cohen Children's Medical Center, where she works with employees to identify and utilize character strength to increase self-awareness, resilience, and effectiveness. She's also the Director for Professional Development and the Director for Holistic Services at Cohen Children's Medical Center, and I'm delighted to welcome her to Well Said. Phyllis, welcome.
It's a pleasure to be here.
Phyllis, you work at Cohen Children's Medical Center, which is part of Northwell Health. For our listeners who may be unfamiliar with the institution and with children's hospitals in general, tell us a little bit about CCMC and why children's hospitals exist as separate institutions as opposed to just admitting kids to hospitals that also care for adults.
I think we've outgrown the pediatric floor or floors in a general hospital. Pediatrics is a specialty unto itself, and the interprofessional team that cares for pediatric patients are very schooled in the special uniqueness of working with pediatric patients and their families. We treat patients and families as a solid unit. So medications are different, treatments are different, but we also very much want to keep the childhood in the child while they're going through some very, very adult situations. And Cohen is extremely unique and capable at being that. It is the number one children's hospital in New York State. It's number 4 on the East Coast. And nationally, we're ranked 10 out of 10 in clinical settings, according to U.S. News and World Report. We're 206 beds with a very, very dynamic emergency department that sees well over 45,000 people a year, patients a year. And that's everything from cuts and scrapes and bruises to behavioral health issues.
When you say keep the child in the patient, is that what?
Keep the childhood in the child.
Keep the childhood in the child,
right.
Yeah. What do you mean by that?
Well, these kids are facing some really dynamic things. A lot of people will say, oh, you get to work with kids, but it's not Disneyland. Our children are very sick. They're facing some very, very difficult diagnoses and years, treatment in years ahead of them, or they're injured. Of course, then we have to have multiple surgeries, and they have a long rehab in front of them. You want to definitely keep up with their schoolwork, although they may not want to. But you want to keep up with their schoolwork, but you also, want to be able to play. You want to be able to find joy. You want to socialize. You want to do the best you can to keep them connected to their siblings and their friends. And just maybe a good old-fashioned video game. Or as my holistic team, would you go up and would you like to have some foot reflexology, a foot massage? Would that make you feel better? And children love to have their feet rubbed. So it's just a really good thing to be able to help them to relax without using medication. And then the talking happens, and they will tell you some very, very personal things. And you see that these amazing children are starting to grow up well beyond their years too soon because they have to. Yeah.
You use the word holistic. Your title is Director of Holistic Services, which I got to say struck me as a little unusual. Mm-hmm. So what is under the umbrella of Holistic Services at Cohen Children's Medical Center?
Well, this was a program started in 2013 by Kathleen O'Kane, who was a NICU nurse, who became a certified holistic nurse. And, went down to administration and said, I think we can do better in taking care of our family caregivers. And administration at the time said, we agree. Tell us what you need. We can give you everything but space. So she, dragged around a massage chair and offered Reiki. And for a couple of years, she popped up in various places along with a per diem certified holistic nurse and a volunteer. and they were taking care of family caregivers who were really, starting to wither a bit.
And when you say family caregivers, you're talking about parents and other people
extended
attached
family,
to
right,
the
sure.
patient.
See, unfortunately, our kids aren't usually in and out. They're with us for weeks, maybe months. So mom and dad have to take care of the rest of the family. They have to go to work. So grandma, grandpa, older siblings might step in, godparents. So we offer it to everyone there. So we have 3 distinct groups. We have our staff that we offer holistic services to, our admitted pediatric patients, and their parents and family caregivers. It's a very, very robust program.
And these services are what exactly?
Well, they're holistic. They're massage, they're guided meditation, they're breathing exercises, reflexology, Reiki, big one, supportive listening. We do arm and hand and foot reflexology, acupressure. And it's just really pretty amazing. We have, thanks to the efforts of Carrie Quinn and Brian Belpano and Sophia Agarisis, we have a 600-plus square foot integrative holistic center where we offer these services to the staff and the parents and family caregivers. The services we offer to the patients is at the bedside.
And you also are responsible for professional development and coaching of the professional staff at the hospital. Is that right?
So the professional development piece, I think, is like an umbrella title. My role really is in the career and personal coaching of everyone from the mailroom to the C-suite.
So tell us what your definition of coaching is, because I think a lot of people may have misconceptions of what that means.
Well, not to be mixed up with mentoring, which is really the most common thing. Coaching is a strength-based approach to working with an individual where they're at in order to help them achieve some goals that they have identified for themselves. So it's the art of asking great questions to help spotlight blind spots in an individual as they very much want to work on either personal issues or career issues that they feel might be holding them back from living the dream. And that's what coaching really is. It's something that is driven by the person being coached. And it's not where we go in and fix anything. We don't see anyone as broken. We actually work with their strengths and help to develop those strengths or help them identify that they're overusing some strengths and it's causing them problems. Those strengths can now become liabilities when that happens.
So hearing that, I suspect some people listening to our conversation may say, oh, that sounds a lot like psychotherapy. How is it different?
Well, I'm very conscious about not driving in those lanes. Okay? So again, it is strength-based. No one's broken. I'm not diagnosing anything, and I'm not recommending any treatment. I'm also not saying I want to see you in 2 weeks. The person being coached decides if they want to come back for more coaching. They decide the topic of the coaching session. They initially will say to me, I have A, B, C goal that I'd like to achieve. And in 2 months, we're going down a different path. I simply say to them, have you changed your goals? Are these goals now shifting? And if they are, okay, fine, great. Now we'll go in that direction. In other words, I am guiding and supporting the person mostly on their journey of developing their emotional intelligence, which I feel is the secret source for resilience and well-being.
Yeah. I've heard some people distinguish coaching from psychotherapy by saying that the coaching has a sort of prospective orientation and psychotherapy has a retrospective orientation, meaning you're feeling something out of place or things are not going well in your life. Let's try to understand how you got here, as opposed to coaching, which is here we are. Where do you want to go? How can we get you there? Do you think that's fair?
Well, coaching is very much in the moment. I think that's what you're alluding to, as opposed to going back to childhood events or things of that nature. Again, it's strength-based. So we see the person as whole. We don't see them as anything but whole. When we're listening with a sense of you have the answers inside of you, and I'm going to work with you until you have that moment where you go, of course, I get it.
Yeah, and I guess that also distinguishes it from mentorship, where The mentor basically says, I have the answer. Let me share it
Let
with
me
you.
fix this for you.
Yes.
Okay. And
Yeah.
coaching is not that in the least, or just the opposite, actually. Coaching can be episodic. I have people who I have coached for years, but there may be 6 months between coaching sessions. It might be a full year. People have circled back after several years and said, I'd like to continue coaching with you. Where mentoring is something that is, usually goes on for years, and it's a very different focus.
Yeah.
There's a lot more direction and suggesting and going on, where coaching is more guidance and mirroring back and echoing back what people are saying, and do I really understand what you're saying, or help me understand why you insist on this course of behavior when we've actually said it's not working.
Tell us a little bit about your professional background. How did you come to this kind of work?
I am a registered nurse, been a nurse for many, many years, started off in critical care emergency trauma. I actually was a psychiatric social worker for about 20 minutes and decided...
Not your thing.
It wasn't for me there. I was going to be the world's greatest psychiatric nurse after I went back to school, but rotated through an ICU and an emergency department, and that was the end of that. I have varied off the reservation and gone into subacute care and long-term care and home care and all those other different aspects. I've ventured into entrepreneurial ventures as well. So my background, is very varied. But I think what really brought me to coaching was the fact that I was doing professional developer, otherwise known as nursing education. And people would come and speak with me. And, you don't go and talk to your administrator because that's crime and punishment. You go talk to your educator because it's more nurturing. I felt as though I was making a difference and an impact, and I felt good about it. So I started to study it. And that's when I started going in that direction. I did not actually focus on the issue of resilience, well-being, burnout, things of those natures in my coaching until one fine day I got a phone call from a prospective client who said I had to help her. She couldn't take care of patients anymore, and she only knew how to be a nurse. How could I help her? So I immediately thought she was either surviving cancer or maybe had an ergonomic issue. So I talked to her a little bit more and said, gee, I don't want to get all up in your PHI, but, tell me about your resilience, your stamina.
PHI meaning her personal health information.
Personal health. But tell me about your stamina, just to get a sense of what direction we're going in. She starts laughing, and she goes, I'm as healthy as a horse. I just never want to see a patient again. If I never see another doctor or nurse, that'd be fine too. Now I thought I had a crank call. And then I realized I had my first full-blown case of caregiver fatigue, where people were really separated from mission and purpose and suffering from that umbrella of burnout. So I shifted and pivoted a little bit and really, leaned into studying about that, so I was that much more prepared for that situation.
Why do you think professional caregivers are facing these sorts of crises now? Is there something about the way we organize care or deliver care that makes this so important right now? Why should the average patient take interest in this?
Medicine and nursing and all of the other caring professions have become far more complex. I'm not going to, minimize that in the least. I think life in itself has become far more complex. More is being asked of us, and in many ways we try to defy the law of physics by putting 10 pounds in a 5-pound bag. And it doesn't work. And there is that sense. I think also we're starting to realize that those of us in the caring professions have always put ourselves last, have always put others first, and we have found satisfaction in that. But we are now realizing that you cannot give from that empty cup. So we need to really build our own sense of strength and inner resilience so that you have that much more to give, which is why I specialize in working with emotional intelligence and applies positive psychology and character strengths, because those are the secret sauce, the ingredients, the foundation of building true resilience and true senses of well-being.
What are some of the more specific kinds of challenges or issues that people come to you with? So you described a complex, fast-paced, emotionally challenging environment where these folks work. What do they say to you that they need help with?
Well, if they're in leadership, they've probably gotten some feedback that they are a little rough around the edges, that they don't have the people skills, that maybe they need to learn how to make better relationships, which in and of itself is probably the better way to go. But now how do you do that? And, so when we're talking about character strengths, I might give them a little tool or an assessment, the VIA Character Strengths Survey. And one of their character strengths might come up to be judgment. Now, judgment's a wonderful thing. And of course, you want to have good judgment in a leader. And we've done a terrific job as clinicians, pounding in that you have to make an accurate assessment and a quick judgment because lives depend upon it. But that's in the clinical setting. If you're working with people, curiosity will serve you better. Your mantra when you are working with people is tell me more, not go to the quick judgment and have people feel as though you sum them up in 30 seconds or less. It's really, being curious about people and interested and developing listening skills to the degree that that person you are leading or you want to develop followership with is actually convinced that you are authentic, you are reliable, you are the real deal, and you're truly interested. And once you make that relationship with that person, then they're going to start to make a decision that I want to follow you as opposed to you leading them. And we are now at that point where we need to shift. The thing leaders truly need to understand is post-COVID, I've talked to hundreds and hundreds of professional caregivers through COVID and post-COVID. And one of the things I have asked them is, tell me about your COVID experience. And almost to a person, Ira, they have said, I'm stronger than I ever thought I could be. Now, I know media would like to say that we are all burnt out or this or that. We are not. I'm stronger than I ever thought I could be is the language of growth. And we have to appreciate that those folks that were at the bedside and really, the frontline folks have leveled up and have had a transformative experience that has empowered them beyond something that they had ever experienced before. If we don't appreciate that in our staff, regardless of how they manifest your caregiving, if we don't realize that in our staff and then level up as leaders, we are going to bleed talent, which is exactly what happened right after COVID. People wanted everything to go back to the way it was. And the staff and others were saying, no, I can't do that anymore. We're going to have to improve this. The same old transactional forms of leadership are not going to work. And it was sad because we were making strides towards developing humanistic approaches to leadership. And then COVID hit, and of course, transactional had to happen. That's the way we beat the bug. That's how we saved everyone's lives, including our own. Now you get really comfortable in being transactional, and the work of developing that humanistic lean and approach towards leadership is so essential that we have to get back to doing that. And hopefully we appreciate that and level up as leaders before we bleed talent, because the staff is feeling very empowered now and very confident and competent. And you want to match that with your leadership skills and inspire them to follow you to what's next.
I'm struck by the fact that you're talking about a staff that feels like they've survived the test, right? They came through this terrible period and have recognized their ability to kind of stare down a terrible set of circumstances and come through it. And yet we're also talking about burnout. Mm-hmm. Can you reconcile that a little bit for me?
I certainly can. You have to understand, first of all, what is real true burnout? And true burnout, you have lost the connection between mission and purpose. You can no longer get up in the morning and find the reason or the why. You're not getting the same satisfaction from what you're doing. In fact, you have overused your compassionate nature, or maybe didn't put enough healthy boundaries around your compassionate nature, that it's no longer safe to live there and give from your compassionate nature, care from your compassion. You move into your academic head where it's easy because you don't feel. You still give the same level of care. You still show up to work on time. You're a good teammate, but something's gone. There's a blankness in your eyes, and there's a disconnect between your mission and your purpose. It has now become a job. Might be a good job, but still a job nonetheless. What I would like leaders to understand is that the staff is not, by and large, it's not what I'm hearing. They're not coming to me saying that they're burnt out. They're weary. They're weary. Bone tired, weary. And what they're most weary of is trying to maintain this sense of have to change, have to pivot, have to be nimble, have to adjust. And the whole idea of the persistent uncertainty that we're living in right now is not the way we are hardwired as humans. We are, by definition, clinicians that work with policy, procedures, algorithms. We want to know, do this and then do that. Don't do that. And when you say to someone, well, what's going to happen in 6 months, and I don't know, has to be the legitimate answer, it's unsettling. We're not in a time where we can put our foot on solid ground. Mm-hmm. Which is why coaching is important, because you try to develop that resilience to understand the strength is within you, not without you, or outside of you, but within you. And you can navigate the persistent uncertainty slowly. But leaders are, I think, at times misjudging burnout for weariness, and the persistent weariness causes disengagement.
So your advice to somebody leading a group of professional caregivers who are in that state would be what?
Really take a look at your approach to change management. First of all, we have to do things incrementally. There has to be small tests of change, what I might call phases of change. You might want to use a human-centered design approach to change management and make sure that you are starting with the end user, the clinician, and don't try to fix something without getting the input from the staff about what actually is broken. The worst thing you can do is try to fix something only to find out that wasn't broken. And it happens all the time. But you work with the staff and you say, okay, here's something that you are telling me we need to fix, or here's something that's coming from Joint Commission, Department of Health, whatever. And you say, okay, this is a pretty big problem. And the question would be, well, how are we going to do this? I don't know, but we're going to figure it out. There's that pioneer spirit that has to happen right now in the face of persistent uncertainty that forces transparency and authenticity. And in that transparency and authenticity of a leader comes trust and then followership. So small tests of change. Okay, so here's what phase 1's going to look like. Well, what's phase 2 going to look like? I don't know. When you tell me what's wrong with phase 1 and how we need to adjust it, that will be phase 2. And I think we have to have a little bit more appreciation for the weariness and be a little bit more discerning about the amount of change or new initiatives or whatever we're doing, the amount that we stuff into a 10-pound bag in the course of a year.
Yeah. And yet we both recognize that there has to be a lot of change.
Flexibility, not necessarily change. And if you start to use a mantra, well, we're going to get it wrong until we get it right. Amy Edmonton talks about the right kind of mistake, making the right kind of error, where we're not going to beat you up if it doesn't fit perfectly right away. We understand that as we are redesigning something, circumstances are changing around us. And once we even meet that initial redesign, we may have to modify that design because of circumstances. But you have to develop the mindset and the culture of, it's a journey, it's a process. We're going to get it wrong until we get it right. Everybody take a breath and let's get creative.
Yeah. I'm glad you mentioned Amy Edmonton. I'm a big fan of hers. You want to just tell our listeners who she is?
She is the guru for change management and quality in just about every industry across the world.
Yeah. So she's a professor at Harvard Business School.
Yes,
Has
she
written
is.
a lot about
teams, flexibility.
Yeah, exactly.
She is the person, I believe, who came up with the term psychological safety.
Yes, I think you're right. You used another term before that I think is worth kind of spending a few more minutes talking about, and that's emotional intelligence. Mm-hmm. What is emotional intelligence, and how does that play into the issues we've been talking about?
So for, emotional intelligence is the secret sauce to a happy life or a happier career.
Oh, nothing too important?
No, not too important at all. I certainly was one of the folks back in the 80s and 90s that was pushing, get a great academic preparation, get as many clinical certifications, good clinical skills,
That's all you need.
Everything will be fine.
Right.
And then, of course, it wasn't. So the emotional intelligence is really, taking a good look at yourself, understanding your triggers, your motivations, understanding what makes you tick, how do you react, and then also then saying, am I the master of myself, or am I being moved around a chessboard by my emotions, my triggers, my ethics, my unbiased consciousness? It's just really understanding that if you have the courage, and I talk about when we do it, you're working with your self-awareness, it can feel like you're chewing on glass, which is the world's worst marketing tagline. For accomplished adults, it can feel very painful to acknowledge that they are self-sabotaging and never realized it, or realize it but don't know how to stop doing it. The emotional intelligence is, the first one would be self-awareness, where you realize it, and then self-management, where you actually make a plan and find the heart and the discipline to change that. And it can be a transformative experience. Once you lean in and you realize how difficult it is to be an adult in the 21st century, let alone in healthcare, let alone in leadership, that's really where your compassion and empathy for being a human comes from, in that it creates a softness with you, which is just the opposite of what we've been told all along. Things get tough, suck it up, buttercup, right? I'm saying when things get tough, soften up, lean into the discomfort. And in that leaning in, you will find your strength, and you will find empathy and compassion. And if you are able to do that, you can move on to social awareness and relationship management, which really are the competencies of leadership.
I think you wrapped it up very nicely there at the end. So know yourself, be able to control yourself so that you can interact in a more authentic and fruitful way with those around you.
So, Ira, I've had a long administrative career, and there's only one question I ask when I'm hiring somebody for a leadership position. Tell me why someone would want to be led by you. I don't want to hear about Harvard. I don't want to hear about clinical skills. I don't want to hear about your I'm certified in this and certified in that. I want you to tell me why people believe in you, see you as authentic, and want to follow you. Tell me about that. Why should somebody want to be led by you is the only question you should be able to ask at an interview for leaders, and that answer will tell you if you have the right person in front of you or not.
Well, that's pretty profound. I think we should probably end it there. A little bit of a cliffhanger maybe, but hopefully food for thought for people who are interested in developing their own emotional intelligence, thinking about where they fit in this complex web of administrative hierarchy. Thank you so much for joining us today.
It was a pleasure. Thank you.
My guest has been Dr. Phyllis Quinlan. She is the Director of Professional Development and Holistic Services at Cohen Children's Medical Center. Thanks also to our editor, Edward Lee, our producer, Lois Bentavenia, and our audio engineer, John Mullen. For more information about this program and to find all of our past episodes, please visit our website at medicine.hofstra.edu/wellsaid. You can also subscribe to our free podcast wherever you get your podcasts. Our listeners are also welcome to send their comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.